this is Brian Casey from ECR 2023. We are here with Professor Luca Sconfienza of Milano, Italy. Professor Sconfienza, thanks for being with us today.
Thank you very much.
Now, you're a radiologist. You work with many different modalities, and you look at lots of different organ groups. What are some of the things that you find particularly useful with ultrasound for musculoskeletal applications?
I think that all the imaging modalities are very important in musculoskeletal because they provide a very panoramic evaluation of the joint or the organ. However, ultrasound is very, very important because it helps very, very much to assess the very superficial structure, namely those located between the skin and about 2-3 centimeters. This is very important because ultrasound provides real-time evaluation or also very, very thin structures. And this is great because most of the structures in the musculoskeletal system are very thin.
Now, what about using ultrasound for deeper penetration? What are some of the challenges there?
We have to think that not all the patients are equal. So in many patients we are able to see the superficial structures, but we also have patients in whom we need deeper evaluation. In this sense, we need multiple probes that allows us for an evaluation of all the structures. However, very recently we have some probes that can provide in a single instrument multiple frequencies that allow for very superficial but also deep evaluation of the organs.
Now, could you give examples of some of these probes and what you think they're particularly useful for?
Clearly, ESOT has now developed a new probe, which is 4 to 20 megahertz, which is capable to range a wide variety of frequencies, so to go from structures in the skin and the very few millimeters of the human body to deeper structure up to 4 to 5 centimeters. This is very good because, as we said, not all patients are created equal.
Now, is it challenging for radiologists to decide which probe to use, or do they have a pretty clear idea of what probe to use for what application?
Well, usually general radiologists prefer to use a single probe for all the applications. So in this case, having a probe which has a very wide range of frequency, just changing the settings of the probe itself is very helpful and also allows you for saving time when you do the examination.
Probably a lot more efficient as well, right?
Definitely, yes.
Now, can you talk a little bit about B-mode ultrasound in MSK imaging and how that's useful?
B-mode is the traditional modality of musculoskeletal ultrasound in which we are able to see all the structures, the anatomy, and the presence of pathological alteration. Also when we need to assess very tiny details. In this sense, B-mode is very, very helpful because it's the mainstay of musculoskeletal ultrasound.
Any other advanced applications in ultrasound that you think are really useful for MSK imaging?
Clearly, power Doppler is very, very important, and nowadays we have a very new application like those applications in Doppler which allows to assess very small flows, which are very, very helpful to detect even tiny pathological areas for patients. We also have elastography, which is very helpful in the evaluation of pathological area even when they are not visible at B-mode. We can also have fusion imaging, which is the fusion between ultrasound and another imaging modality like MRI or CT. In MSK, actually, we lose one very important thing, which is the dynamic capability of ultrasonography. However, in the future, we will be able to probably fuse also with the dynamic capability of all modalities.
Right. Now, what are some of the aspects of products today that you think they need to have in order to meet the challenges that radiologists have?
I think that on the one hand, the product needs to be very usable in daily practice, so improve the workflow and making the physician saving time. This is one very important aspect. The second thing is to provide the physician tools with together saving time, also improving the diagnostic performance with a high-end solution that may be very helpful for the patient.
What do you think about some of the products that SAOT is showing at this meeting?
I think that especially in the last years, SAOT was capable to introduce very new solutions that are able to put together what we have said before, so the workflow improvement and also the high-end solution that may be very, very helpful for the diagnosis in musculoskeletal system.
Very good. Well, anything you'd like to add, Dr. Sconfienza?
I think that we hope this ECR would be excellent for all of us, and very happy to be here in March back again.
Very good. Well, thanks for being with us today.
Thank you very much.
Signing off from ECR 2023, my name is Brian Casey.